thank you so much for being here today. I'm incredibly grateful to you that you're willing to share your time and your knowledge with our Alamo Heights community. We're going to have a quick conversation about the facts and specific information that we should be aware of regarding the COVID-19 vaccine for children. So I want to start by having you talk a little bit about the safety of the vaccine for kids.
Great. Well, thank you for having me on. And as a parent, I know everybody wants to talk about safety, particularly when we're talking about giving this vaccine to our children. I guess my biggest endorsement of the vaccine is I've gotten it myself. My wife has gotten it. My 3 kids who are 20 and older have gotten both doses, and I've given it to my 12-year-old. She got her first dose about 2 hours after the CDC approved it last Wednesday. So I obviously am feeling comfortable not just recommending it to others and my patients. I've given it to my own children. I think when we talk about safety, we probably should talk about kind of the immediate or the right now safety of it. And then obviously people have questions about what's the long-term safety of this. And I think when you talk about the short term right now, I think we have to remember that this vaccine has been in clinical trials for about a year now. So we've had people that, go back almost a year, for the Pfizer down to 16, the other one's 18 and older. And in our country right now, and the 3 that are approved, the Pfizer, Moderna, and Johnson & Johnson, over 150 million adults have received that vaccine. And, with all of those doses, we've seen very little to be worried about in terms of the side effects. So for the Pfizer and Moderna, there were some concerns early on about some allergic reactions. A few people, we heard about that. You're really not hearing about people talking about allergic reaction with those. But that is why we watch somebody for 15 minutes afterwards to make sure they're not having an allergic reaction. On the Johnson & Johnson, when we studied that after millions have gotten it, we did see that there was a rare association with a blood clot. And thankfully, now that we know about that and we know how to treat that particular kind of blood clot, that can be managed. That's a really rare complication. Now, if I was between the ages of 18 and 50 and female, and that was the only vaccine that was available, I would say I think the risk of the disease outweighs the risk of the rare chance of a blood clot. Knowing that there are other vaccines in the Moderna and Pfizer, I would recommend somebody in that age range, female, to get the Moderna or the Pfizer. But that's really all that has come up with, again, across the world. Even just the Pfizer that's approved down to 12 with kids, probably 100 million doses, and nothing else is showing up here since we've been doing lots of them since December. Now, I think a lot of people have talked to friends who have gotten it and realized, particularly after the second one, you can have a sore arm for a couple of days. A number of people will have a fever or headache, feel achy, that can last for 24, 36 hours. But besides that, we really do feel very comfortable about the safety that we've learned with hundreds of millions of doses given around the world. So obviously a logical question from parents is, well, what about the long-term safety of this? And I wish I could quote the 10-year data. We just obviously can't. We've had it for a year. But I think to understand the long-term safety, I think it's important to understand how the vaccine works. And I'm going to be particularly talking about the mRNA ones, which is your Pfizer and Moderna. But to me, it's fascinating that when we get those vaccines, the messenger RNA does go into the cell, goes into the cytoplasm, and it tells the body to make an antibody against the spike protein of the coronavirus, the COVID-19 virus. And then it goes poof, and it kind of just disappears. And so it's really only in us for a few hours. It's kind of like the old Mission Impossible, where they come in and say, this is your mission, should you accept it? And then the tape recorder goes poof and blows up. And so it's really not in us. It never gets into the nucleus. It's RNA. It never can get turned into DNA. So it's never going to be part of anybody's genetic makeup. So knowing that, particularly about the Pfizer, which is approved for our children down to age 12, there's nothing of it that I know about it that would make me concerned about the long-term safety of it. And again, my biggest endorsement towards that end is I've given it to my daughter who's 25 in childbearing age, and to my 12-year-old daughter as well.
Okay, great. Do we know anything about the effectiveness of the vaccine?
Yeah, I think that particularly when we look at the Moderna and Pfizer, their efficacy is about 95% against disease. Period. The When you look at severe disease and death, it's 100%. So they've been very effective, and that when something's 95% effective in terms of disease, period, it does mean that 1 in 20 who get the vaccine could still get coronavirus, the COVID-19 virus, but we would expect them to have a very mild course of that.
Okay. And with children, is an additional booster needed?
Well, I think that's a great question. I think there's probably two questions in there. I think the first question is, how long is the vaccine going to last? And the answer is, we don't know. I think we're about 6 months out from the masses getting it and feeling still pretty good about it. Is there going to be a time where the COVID-19 virus is still in our community? We feel like antibodies are waning at a year, and we need to give a booster of that. I do think that's a possibility. But I think the other question is, this is not the first time we've seen a coronavirus cause problems. Never a pandemic like this, but clearly epidemics. We had SARS, we had MERS, and so if there were SARS and MERS and now COVID-19, is coronavirus gonna become a virus kind of like the flu vaccine, where you get a yearly flu, you get a yearly coronavirus vaccine, and we kind of think through and guesstimate what are the strains that we're going to see. And I think some people think that may be something that we see in the future. So that would not necessarily be a booster. That would be just a yearly vaccine, but we may still have to do a booster for the current vaccine, depending on how long the antibodies last.
Okay. And kind of along those same lines, if I were to get my child vaccinated with COVID-19 vaccine, can I do routine vaccines at the same time?
It's a great question. And thankfully, the answer to that is yes. The CDC originally had said they wanted to have 2 weeks between a COVID vaccine and a regular vaccine, not because they knew something to be a problem, it was just unknown. But with more time, the CDC last Wednesday, the same time they approved it down to age 12 for the Pfizer, they said it is okay to get a routine vaccine. So if somebody's coming in and they're getting their Menactra or their tetanus or their Gardasil, it is okay to get that vaccine and the COVID at the same time. Or if they got the COVID vaccine a week ago and they're seeing their pediatrician for their checkup, it is okay to get routine vaccines at that visit.
Well, that certainly makes it convenient. So,
and that will be huge next year when this vaccine hopefully will be approved for younger kids, that when we're talking about getting a flu vaccine and a COVID vaccine. And if you have to wait 2 weeks between everything, that would make it a lot of visits to the doctor's office to get the vaccine. So that's nice that we don't have to wait.
mm-hmm. Do you have any inside track information about developments for the vaccine for kids 6 to 12?
Well, I'm not sure if I necessarily have the inside scoop on that. I kind of learn some of my information from the New York Times every morning, like some of the parents do, and call our office before we hear it from the CDC. But Pfizer does have trials that are underway for 2 to 11 years of age, and they believe that in September they're going to have the data to present. And how long will it take for the CDC, FDA to approve it? But hopefully by the end of September, 1st of October, we'll have a vaccine down to 2. Moderna has some trials of their vaccine down to 6 months. Don't know when that data is going to be out, but hopefully sometime this fall we'll even have some safety and efficacy data down to 6 months of age. The Moderna trial that's down to 12, which would be 12 to 18 for theirs. Their data is supposed to come out this summer. So then once that gets approved, then there's 2 options for the 12 and older.
Okay. So since I have you, is there anything that I didn't ask that you would really like for parents to know about the vaccine for children?
Well, I will say a common question that we get every day is, and it's a great question, is from what we've seen over the past year, children seem to do very well with this virus, which is a huge blessing. I mean, typically it's the young and the old that do poorly. And thankfully, the range or the age group that does the best with COVID is the newborns. And so thankfully, we're not seeing the pediatric population getting really sick. So why, if that's the case, should we vaccinate our children? And I would say that I have three answers. And the first is, it is possible that a child could get COVID-19 and get sicker from it. I think it's rare. So it's going to be pretty uncommon. It's going to be more likely if somebody has an underlying health condition like diabetes or asthma, but it can happen. And then there's also the multi-system inflammatory syndrome that we've seen. Our office has had two patients that have been admitted to the hospital, one who was particularly sick and thankfully is recovering. But there are rare complications to this virus. Now, there are rare complications to the other common viruses we see out there too. So I don't think it's different than the normal virus, but we do have a vaccine to be able to prevent that. So if we can feel that the vaccine is safe and effective, and it can prevent a rare complication, I think it's worthwhile doing that. Meningitis from Neisseria meningitidis is really rare, but we give it to our kids before we go off to college because it's really bad if they get that. So there are other precedents of vaccines that we give that it's pretty rare to have the complication. But if it's your child, it's not 1 in a million, it's 1 in 1. So I think one, the vaccine will help to prevent something that is rare. I think two, there's the freedom. One of my last patients that I just saw is a senior at Alamo Heights, and she's getting ready to graduate, and she has an illness symptoms and a sinus infection, and I didn't have to swab her nose today because she's had the vaccine. So I think when somebody's had the vaccine and they get illness symptoms, we don't have to, without a known exposure, we don't have to swab their nose. And when somebody gets exposed to COVID-19, they don't have to quarantine for 2 weeks if they've been vaccinated. So there's a lot of freedom that comes with that. Now, if somebody is vaccinated and they get exposed and they develop symptoms, then we do need to test that person because we just said 1 in 20 could still get it. But it does give you a lot of freedom of knowing I don't have to quarantine as often and I don't have to get my nose swabbed as often. And then the third reason is really more the global reason, but it's for the good of the greater community. And that's sometimes the harder one for us to think as parents, because obviously we want to think what's best for our child and how do I keep my child safe. But I do think that we do need to step back and say, yes, I need to keep my child safe, but we live in a community. And I think we also need to think through what's the best for our community. And the quicker we get people vaccinated, the quicker we get back to life as we used to know it. And the longer this pandemic goes on, the greater the chance that another variant can happen, or that we start losing our antibodies and have to do boosters. So the quicker we can get people vaccinated, not just in the United States, it's really a global thing. We got to vaccinate around the world, but the quicker we can do that, the quicker we get back to our old sense of normal. So I think there is a sense of community duty to say I'm benefiting the community when I have my children vaccinated as well.
Well, thank you so much for all of that information. It's a wealth of knowledge that you have, and we're so grateful that you're sharing it with all of us. So to wrap up things today, can you just tell us where parents can take their kids to get the vaccine?
Absolutely. I mean, I think the first thing is call the pediatrician's office. We're doing it and setting up clinics in our office for our patients, but there is a hassle factor for the vaccine, particularly the Pfizer. We know where to get dry ice now to keep it on dry ice, and we have a thermometer in it. And if it goes below 70 degrees, minus 70 degrees, we get notified by a text. So there's the hassle factor. So there are probably not as many clinics that are doing that, but there are plenty of places that they can go and get it done. They can go to HEB, Walgreens, or CVS. They can go down to the Alamo Dome. So there are plenty of places to go and to get it. And so back in January and February, it was a mad rush to figure out where can I get it done. It's pretty easy to walk in and get a vaccine somewhere today.
Okay, great. Thank you so much.
You bet. Thank you for having me on today.